Hello, and thank you for watching this important video to show you how to correctly give your child a breathing treatment with an inhaler and spacer. After you have viewed this information, the nurse or respiratory therapist will ask you a few questions and have you demonstrate your understanding and ability to give a treatment. This is a metered dose inhaler, or MDI. Medication from the MDI can only work if it is used correctly. The medicine in the canister is under pressure, and because of this, a spacer or holding chamber must always be used to administer the medication. If this spacer is not used, the medication may not get to the lungs and can't do its job. The spacer allows for the medication particles that have left the canister to be held in the chamber for 3 to 5 seconds. This allows your child time to breathe in and out 5 to 6 times through the mask attached, drawing the medicine into the lungs. Let's talk a little bit about the MDI. The inhaler prescribed to your child may contain a bronchodilator, such as albuterol, which is a fast-acting reliever medication, or it may be a corticosteroid, such as Flovent, which is a controller medication. It is important to know which medication is in the inhaler before giving a treatment. Inhalers can also have different amounts of medication inside, so to make it simple to keep track of how much is left, a counter can be found on the back of the inhaler. Please pay close attention to the counter and refill through your pharmacy or physician, making sure you have at least a 3-day supply between refills. Before you use the inhaler for the first time, or any time it has not been used for 2 weeks or more, it is necessary to prime the MDI. To do this, you simply shake the inhaler, then spray 2 to 4 times away from your face. These puffs do not count towards your medication dose, but you should see the counter on the back go down by the number of puffs used to prime the inhaler. Now, the inhaler is ready to use. In order for your child to get all of the medicine out of the holding chamber, you will be using a face mask along with the spacer. The goal is to hold a good seal around the nose and mouth for at least 5 to 6 breaths in and out. This way, all of the medicine is breathed into the lungs without any escaping around the mask. For some children, this can be difficult, maybe even a little scary. Getting comfortable with the mask and how it feels on the face is very important. A few tips to getting there may be letting your child play with the mask, making a game out of using it, placing the mask on a favorite toy or stuffed animal, or other fun activities suitable for your child. When it is time for your child's treatment, you will hold the inhaler, prime if necessary, remove the cap and give it a good shake 3 to 5 times. Place the MDI into the holding chamber, making sure it's all the way. Have your child sit upright or stand. This is the best position for the medicine to get all to areas of the lungs. Place the mask over the child's mouth and nose with a firm seal. This is important so that none of the medicine can escape around the sides of the mask. Press down on the inhaler. This is 1 puff. While holding the mask firmly on the child's face, have them breathe normally for 6 breaths. They can exhale through the flap on the top of the spacer. You will see this flap go up and down as your child breathes in and out through the mask and spacer. It may be helpful to count out loud, sing a song, or distract them with a toy or video during this time. Remove the mask from the child's face and wait 1 minute, and then repeat these steps until you have completed the prescribed amount of puffs. If you are giving your child an inhaled steroid, you will want to rinse or wipe their mouth after finishing the treatment. This can be done by brushing their teeth or taking a damp cloth to their tongue and gums. It is important to keep the mask and spacer clean. You will want to wash the spacer when new, then at least once a month, and any time after recovering from a cold or respiratory infection. The spacer may become a bit cloudy over time. That's okay, but it shouldn't be discolored. To clean your spacer, disassemble your spacer, wash all of the parts, including the mask, in clean, warm water with liquid dishwashing detergent. Allow the parts of the spacer to air dry. Drying with a cloth or paper towel can result in static building up on the inside of the spacer, which makes the medication stick to the sides. You may wipe the mask if needed, and then reassemble all of the parts once completely dry. Please be sure to ask any questions you may have regarding these instructions. Soon, your respiratory therapist or nurse will be here to answer any questions and make sure you have a good understanding of this information and have you demonstrate a treatment.